Buenos días. Acabamos de salir de una sesión sobre la formación de los técnicos de farmacia y estamos con Diana Broome del Harris Health System en Houston y nos va a explicar de forma breve algunos de los puntos clave de la formación de los técnicos en Estados Unidos. Thank you very much, Diana.
Yes, thank you.
Could you explain us how is the technicians training in the United States?
Yes, so here in the United States, we do see different types of training systems. So we do have formal education within community colleges and 4 universities, and we also have them now within our hospitals and our health systems. The training also can be different. We have what's called apprenticeships, where they are paid while they are getting their education and their training. And then there's others where once they're hired, they have a formal structured training process. Usually it generally runs for about 6 to 9 weeks. It starts very basic with the individual or the pharmacy technician learning the hospital. They learn where all the different medication units are, the automated dispensing cabinets, and then they learn how to load them. They learn how to what we call replenish those cabinets. They also learn about how to manage the med carousel, and I'm sure you guys have med carousels, right? And so they learn how they manage the med carousels, fill what's called our crash cart drug trays. They learn the sterile compounding piece as well as non-sterile compounding, and repackaging is another important piece. And one of the things that we have started to see more of, we used to see it, it kind of stopped, and now we're seeing it again, where more pharmacy technicians are engaged in what we call the more clinical roles. And in these clinical roles, the pharmacy technicians are being tasked with looking at patients who are on anticoagulants, looking at the INRs, looking at abnormal values, and then flagging those for the pharmacist, so the pharmacist can then provide their clinical recommendations. Other things that technicians could be doing could be looking at IV to PO conversions. If we see patients that are tolerating PO that have had IVs, they flag those and make the pharmacist aware of those. Looking at peaks and troughs for vancomycin prescribing. So if we see anything that needs to be addressed, make sure the pharmacist is aware of it so the pharmacist can provide those clinical interventions. So there's quite a bit. We see different tiered levels of our pharmacy technicians, and so with each of these tiers, they have more and more responsibilities, such as training, creating training manuals. I mean, there's just a lot that a technician can provide. Yes.
And which are the main tasks they do, like in a daily activities?
So that's a really good question. So regardless of what tier you are, all of them have what we call as a foundation, right? So the foundation is going to be filling your Pyxis cabinets, making sure checking what we call floor stock inspections, making sure nothing's expired, making sure you sterile compound, maintaining those anti-room and clean room environments, and really also inventory management. So these are all your very standard function operational activities that all pharmacy technicians need to know how to do, especially with non-sterile compounding.
Thank you very much.
Yes, you're welcome.
Sin duda que son ideas muy interesantes que podremos traspasar para mejorar la formación de los técnicos de farmacia en España, en nuestro país. Thank you very much.
All right, thank you.